applications. We have a large contingent of DNB students. A lot of clinicians love to teach, right? So we have that as well. And for very senior people, we have made them, a part of a retention scheme in terms of stocks, because as the company's value grow, it's only fair that people who are building the value should get a gain share. So we have done that as well, but very selectively. On the nursing side, I think in the last 2 years, I was just, some weeks back doing the nursing day, we actually invested about 7 crores in the last, 2 years only into nursing. Training, education, skilling, benefits, hygiene. I think we're the only ones to have built a dedicated hostel in Greater Noida, about 200 rooms, fully air-conditioned for them. So a lot of investment. Then we also, lucky that we have a joint venture partner in South Africa. So a lot of nurses do want to work overseas, very obviously for salary arbitrage. And we said, why don't you recruit from us? So our joint venture partner came down and recruited about 76 nurses who will now go abroad. So the advantage to us is we're able to retain them a longer time. Advantage to nurses is they don't have to pay intermediaries, and they go, abroad, work for 4 years, and Life Healthcare gets the nurses that they need. So I think we're doing a combination of things of engagement, compensation, research, education to be able to, tackle this issue.
After a series of thought-provoking panel discussions, it was time for the chief guest's address. Former parliamentarian Rashid Alvi urged easier access of quality healthcare services for the economically weaker section of society.
मुझे बहुत खुशी है कि आपके बीच आने का मुझे एक मौका मिला। हेल्थ केयर बुनियादी चीज है। मैं जो प्राइवेट सेक्टर है, जो हमारे दिल्ली के अंदर और मेट्रोपॉलिटन सिटीज के अंदर बड़े हॉस्पिटल्स खुलने हैं, मैं उनसे बहुत मुअद्दबाना दरख्वास्त करूंगा, गरीब लोगों के लिए भी एक हिस्सा बनाइए। कई हॉस्पिटल हैं जिन्होंने गवर्नमेंट से जमीन ली है, 25% उनकी जिम्मेदारी है कि गरीबों को अपने यहाँ इलाज कराएं, लेकिन ऐसा होता नहीं है। मेरे आपसे आज इस प्रोग्राम में यही दरख्वास्त होगी, इस तरीके से कीजिए कि गरीब लोगों को भी उसका फायदा पहुंचे। एक बार फिर मैं आप सबका शुक्रिया अदा करता हूं कि आपने मेरी बात सुनी, और आप सबको मुबारकबाद देता हूं।
See the most spectacular colors. Experience the striking contrast. Feel the stunning details. Bravia 4K HDR. A new era begins.
विमल इलायची, दाने दाने में केसर का दम।
If you want to rule, do things differently. Be fearless. Be unconventional. This is what I do. I trust my intuition. I explore. I embrace risks. I am ready to rule. Jaguar XC presents Ready to Rule, coming soon.
The day-long event concluded with the Businessworld Healthcare Awards 2016, recognizing and felicitating noteworthy efforts by healthcare companies and professionals in the country.
All right, ladies and gentlemen. So the winner for our very first category, the best standalone hospital, the winner is Woodlands Multi-Speciality Hospital Limited, Kolkata. Congratulations, sir. Our next category, ladies and gentlemen, is for the best single specialty hospital chain. And the award in this category goes to Center for Sight. Our next category, ladies and gentlemen, is cleanliness and hygiene. And the award in cleanliness and hygiene goes to Apollo Hospital, Bhubaneswar. The next category, ladies and gentlemen, is for Best Customer Patient Experience, and the award goes to Max Super Specialty Hospital, Mohali. Ladies and gentlemen, our fifth category of the award is for Healthcare CSR of the Year. And the award goes to Fortis Hospital, Mulund. All right, ladies and gentlemen, our next category, the sixth category, is patient safety. And the award goes to Max Super Specialty Hospital, Sake. Our next category is for Innovation in Medical Technology, and the award goes to Critinex Fortis. All right, ladies and gentlemen, our category is for Best Multi-Specialty and Best Super Specialty Hospital, and the winner in this category is Kokilaben Dhirubhai Ambani Hospital and Medical Research Institute. We now have moved towards our last three categories of the award, and currently our category is for the digital solutions. And in this category, there is a tie. We have two winners. The winners are Asian Cancer Institute, Mumbai, and Aster MedCity, Kochi. Ladies and gentlemen, our last two categories, and this category is for Healthcare Personality of the Year. In fact, once again there's a tie, and we have two winners, Dr. Vanita Arora and Dr. Azad Nopen. All right, ladies and gentlemen, our last and the most special category is Jury Special Award. Felicitating the one who is specially recognized by jury panel for his commitment, contribution and leadership over the years in the healthcare industry. The award for Lifetime Achievement. And it is being presented to Dr. Narottam Puri. Request everyone to kindly give a standing ovation to Dr. Narottam Puri, receiving the award for Lifetime Achievement.
Healthcare organizations and private sectors and corporate sectors coming together is the best time when this kind of issues can be discussed, because healthcare will really endorse that yes, there is a problem here, and that's when private sector starts understanding that yes, this is required. End of the day, what happens if a system, why do they give insurance, why do they give medical insurance and medical facilities? So that absenteeism drops down.
Technology would play the major role in the hospital or any facility, medical facility development, not only in terms of increasing efficiency, quality, accuracy, and reducing dependency on the errors of individual, but also to connect among the the resident doctors and among the peers, among the various hospitals.
There are three critical A's for delivering the healthcare services, which is affordability, accessibility and assurance. So till date there has been a significant focus on creating private infrastructure in healthcare, but that has been more kind of saturated in the metro cities or on the urban population. A significant amount or the dearth of scarcity is prevalent in the rural world. So probably that's the region wherein we need to create an infrastructure or the ecosystem wherein the rural masses could also be benefited out of it.
We are completely driven by city-centric approach to Indian healthcare. So if you need good doctor, if you need decent healthcare, you have to come to a large city. And I think that is a big issue that needs to change. That can happen only if quantity of doctors, quantity of provision increases in tier 2, tier 3, smaller cities. So every district needs to have a cath lab. Every district needs to have a neurosurgeon, a cardiologist. And I think that is how it is going to improve and how accessibility is going to improve.
You know, technology can potentially play a very, very important role in terms of giving the choice to the patients or to the consumers in deciding what healthcare service providers or facilities they go to. Today, and traditionally that choice has really been influenced by doctors, okay, by specialists, by your family physicians and GPs. And tomorrow we are looking at a scenario where at least a part of that choice could basically be centralized in patients. That patients will use technology to figure out the whole landscape of healthcare providers close to their home and figure out which healthcare provider they should really go to.
Some are born to make their own way. Introducing the most powerful SUV in its class. The Chevrolet Trailblazer. Follow no one.
Chevrolet, find new roads.
Money. What good is it for if we're not doing good? What about success? Are we going to succeed alone? And what about winning? It's time we realize that today, winning is no longer about proving the world wrong. It's about getting together and making it right.
Chivas, live with chivalry.
नाड़ी शोधन या अनुलोम विलोम प्राणायाम। दाएं अंगूठे को दाहिने नासिका छिद्र पर रखें। बाएं नासिका छिद्र से श्वास अंदर लें, फिर इसे बंद कर लें। दाहिने नासिका छिद्र से श्वास बाहर निकालें। अगली बार दाहिने नासिका छिद्र से सांस भीतर लें। दाहिना नासिका छिद्र बंद करें और बाएं नासिका छिद्र से श्वास बाहर निकालें। यह नाड़ी शोधन का एक चक्र है। 5 चक्र और पूरे करें। इस प्राणायाम का उद्देश्य ऊर्जा